You are watching a recording of a training webinar about how to conduct a systematic review. This webinar series was developed by the Impact Research Programme in partnership with Cochrane Common Mental Disorders and Cochrane Global Mental Health.
I'm Najma Siddiqui, and I'm absolutely delighted to welcome you to the fourth session of our webinar series on systematic reviews. Today we're going to be completing the second part of the session that we had on searching. So I'm going to introduce you again to Judy Wright, who's going to be taking this session. And also today we're joined by Nurture Uphoff, who's going to be helping address questions on chat. I'm going to hand you over now to Judy Wright, who is going to take you through a poll I think we've got first.
So do you use PubMed or maybe an Ovid Medline, which is often available through universities or other institutions, or another version of Medline? We're curious to know which different versions of Medline you're using. Okay, let's close the poll then now. So the vast majority of you are using the free PubMed version of Medline, as opposed to Ovid Medline, which is a paid-for version. So that's really interesting. And the search that I'm showing you today, I've done in PubMed, so you'll see that a little bit. But I think it's just interesting to find this out and to be aware that they are both the same system, they're both the same data. So you can search either one or the other. You don't need to search both of them. It's essentially the same data, but you can do more sophisticated searches with the paid for version. Okay, that's great. So I just wanted to catch up on a few questions from the last session before we sort of launch into today's and look at the homework. So one thing which came up, which I didn't address, was I mentioned hits. And this was when I was talking about when you record all of your searches, and you make a note of everything that you've searched, and I've got a table here that I showed as a really useful way of keeping a record of those searches. And one of the columns says hits, and all this is the number of records that you have found when you've done a search. So I searched Medline for neonatal screening and patient information, and I found 191 records, and it's kind of a shorthand that librarians use that I've just slipped into. The second question we had to catch up on was, is there a central database that says what the databases are for different topics, for example, mental health? So I think this is if you are, so say you're doing a review in mental health and you want to find all the databases for mental health, is there somewhere that you can go and find that out online? And there isn't one big central database that does that, unfortunately. And this is where it's really helpful to talk to your librarians and information specialists that you might have in your institution, because that's part of their role, is to be very up to date and aware of all the different sources and the ones that might be useful for you. There's a couple of places that you can look though. One is the Cochrane resources list, which is it's within the Cochrane handbook. There's a link to a large spreadsheet, and we're sending you these links with the homework, with the accompanying documents with the homework. So in this large spreadsheet, they list all the different resources that they use for doing reviews, and in there's about 150 different databases and websites where you can find trials. They don't tell you exactly what topics they cover, but it is quite a comprehensive list. And then here at the University of Leeds, we've put together a web page where we're listing lots of different databases and websites that you can find trials on. We've organised that by geographical region, so we have a list of international databases and then ones which are specific to different regions. So it doesn't really answer your question for particular topics, but those are areas you can go to. And then I did see a question in the chat just before we started about how many databases should I search for a good systematic review. That's a really good question, and I think it depends a bit on your topic, in that some some clinical areas are covered very well by a small number of databases, and multidisciplinary areas, you'd expect you'd have to search several different, or more databases to cover that multidisciplinary area. You should be searching at least 2. That's really the bare minimum. So you would always search at least Medline and the Cochrane Library. But yeah, I think often people are searching between 5 and 10 databases, sometimes a lot more, sometimes a little bit fewer. Okay. I want to recap again now onto our homework. So again, this was thinking about databases, and I gave an example question, review question, and asked if you could think of the databases and websites that would be useful for this. So the question was about smoking cessation interventions. Which ones of those are effective in reducing smoking among people with schizophrenia in low and middle income countries? So I'd like to open up the chat now, and if you could start to put in any of the databases and websites that you thought of for this, that'll be useful, and we'll see what people are coming up with.
Okay, so we've got PubMed, PacMedinet, Ovid, PsycInfo, and they're coming thick and fast now.
Yes.
Global Index Medicus, including Medline, Embase, Cochrane Central, PsycInfo, Global Health, Ovid, and Web of Science. CINAHL, EBSCO, I don't know that one. Do you?
It's a company that hosts different databases, so you can access CINAHL through EBSCO. So it's a bit like Ovid. There are companies that provide you with databases. So we'd have to be a bit more specific than EBSCO and say exactly which database within EBSCO we were looking at. And the same with Ovid, we'd say whether we were looking at Ovid Medline or Ovid Embase, or which one of those. But yeah, this is great. We've got lots here. So I think we'll. I'm going to move on to the answers. We have had a few different ones, I think, to what I've got in the answers. Not many, but I think PacMedinet and Web of Science. Okay.
And Science Citation Index.
Yes, Science Citation, which is actually part of the Web of Science.
Mm-hmm.
So all of those will be useful. You've covered, I think, all of the ones pretty much that we've listed here in the possible answers. PacMedinet is a Pakistan database that has Pakistan medical journals in, so that's useful. It's a tricky one to search. But yes, if you're looking specifically for that country, that will be useful. And that's the thing with the question that we had, it was about lower middle income countries, so we might want to look at some of those regional databases like that, and like the Global Index Medicus, to make sure we're covering those journals which might not be in the Medline and Embase and PsycInfo. It's great we had PsycInfo in there. That was covering our mental health side, because the psychiatry journals here that we're not going to find in Medline and Embase. And I think we did see some clinical trials registers. I think some of those were coming through in the chat as well, so that was great. One thing I've put in here, I suppose the things to maybe bring out more are the extra places that we might look as well, which are still really good sources of trials. So conference proceedings, they're not always in the databases which you're looking at. So for example, it might be worth looking at a key conference in mental health like the World Psychiatry Congress, because there will be some trials that are mentioned there that never actually have a journal article written about them. So you might want to follow up those. We'd always try and remember to check references of the included studies when we get towards the end of the review process. So once you've decided the studies that are going to go into the review, you go through the reference lists of those studies to see if there's any other trials in there that your searches haven't actually picked up. And finally, contacting experts has been shown to be another really useful way of uncovering other trials which, for one reason or another, haven't made it into a journal article. Okay, that's great. I'm going to move on. We can come back to more questions at the end. So we're going to carry on in our flow through the systematic review process onto the second part of the literature search topic. So in this session, I'm going to look more at how we actually do the search, how we actually put the words in to the databases that we've chosen, and how we design the search strategy using the PCOS that we've developed. So that's looking at the research question, splitting it up and identifying search terms that are going to answer that question really well. We'll also, that's going to be the bulk of the session, but we'll also have a quick look at some software tools for managing all this information that you're going to find, and importantly, how we record all the search activity that you're doing. So how do we design a search strategy from PCOS? Well, when about a month ago now, we had a session on PCOS, on how you formulate your review question using PCOS, and that's a really useful process for getting a nice answerable question, but also for starting to think about how you can structure your search, because we can search for our individual elements of PCOS and tell the database that these are the key things that we're really interested in and that have to appear in the papers that we're finding. So I've got an example here it's similar to the homework, of a review for smoking cessation interventions. Which of these are effective in reducing smoking among people with schizophrenia? So in our PCOS, our P are people with schizophrenia. Our interventions are smoking cessation interventions, but the question is actually about that. We haven't got one specific intervention that we're looking at. We're looking at a whole range. So we need to keep quite an open mind about what they might be and called and how we might search for them. The comparators in this review are other smoking cessation interventions or some kind of standard care. So that's quite a mixed bag of things, and quite similar actually to the interventions. The outcomes for this review are at 6 months and beyond. What changes though in the smoking behaviour? So has smoking cessation happened, or has smoking reduced at least 6 months or later? And it's an effectiveness review, so we are looking for randomised controlled trials. So that's our PCOS. And as I say, what we can do is we can ask the database to find us records that have all of those elements in. However, that does make quite a complicated search if we try to put in absolutely everything from our PCOS. So what we normally do is make life a bit easier for ourselves and just pick the 2 or 3 elements in PCOS that are the easiest to search. They're the most simple concepts, they have the fewest number of alternative terms, and we feel most confident of doing good searches in them. So for this example, the people with schizophrenia is a relatively simple search for us to do. There's not many different ways of saying schizophrenia, so that's good. The second one we're going to look at is smoking cessation interventions, and as I've just mentioned, there's quite a lot of different interventions for this, and we need to be open-minded with that. But I think given the other options, this is a good search for us to do. The comparators are essentially the same as the interventions for this. So if we find trials which are about smoking cessation interventions, then we're going to pick up anything which has the right comparators in there. So I'm not going to search for the comparators. The outcomes, I think, is the trickiest part of this search. So I could ask the database to find me trials where smoking cessation has stopped or been reduced at 6 months or later. And it's that 6 months or later bit which is the tricky bit, because I need to think and put in terms for 6 months with a 6 or the word 6. They might have talked about the number of weeks rather than months, or they might have said half a year. I'm also interested if the trial shows a change at 7 months or 8 months or 9 months. And so I'd have to put in search terms for all those different dates, and that gets very, very tricky. So it's just not worth trying to do that. And if I can do a simpler search where I'm just finding trials which mention schizophrenia and smoking cessation, I'm going to get a large set of results which will have all the trials in that I need, but I then just need to sift them out and take out anything which has got which doesn't have at least 6 months for the outcome measures. So that's what we do. We look and identify which are the easiest elements, and it might be a different set of elements. You might not search for the interventions, but search for the outcomes in your particular instance. Okay, this next slide is about a simple table again that we can put together to start to think about all the different terms we're going to use for our different searches. Because what we're going to do is 3 separate searches, and then we're going to combine them together. Our first search will be about schizophrenia, and we will put all these different terms in to make sure we have all the articles about schizophrenia put together in the database. So I've thought about schizophrenic, schizoaffective disorder, paranoid schizophrenia, all those kinds of terms. Also, we might want to go a little bit broader and include trials on psychosis or psychoses, because they may include patients with schizophrenia in there that we can identify and use. We might want to look more specifically at things like delusions or hallucinations. We really need to think about how authors around the world might have written about schizophrenia in their papers, because not everybody will use the same terms and vocabulary that you will use. So this is an important stage of really trying to imagine how other people might be referring to a particular topic. Okay, my next concept that I'm searching for is smoking cessation. And again, I'm trying to think of lots of different ways that people might have talked about this in their research articles. So key things would be things like stopping smoking, smoking cessation. There might be some very specific interventions like nicotine patches or nicotine gum or e-cigarettes. Those sort of things we know are interventions that would be used for smoking cessation. So we can try and think of loads of those. But that's hard to be comprehensive. So I think if we use terms to do with cigarettes, smoking and tobacco and stopping the use of that, then that should be picking up all of those interventions. Okay, and I've just put in brackets things like the S. So we want to pick up plurals as well as the singular version of terms. And I'll move on to some search tips soon. Okay.
Judy, we're getting a couple of questions about mesh terms and what their relevance and importance is.
Okay, yeah. So the databases that you use have, there's different ways of searching them. So we can, when you put a term into a database, you're normally asking the database to look for that word somewhere in the record, in the title or the abstract or the keyword. And so at that point, you're trying to think of what the authors have said. Some databases use indexing terms as well, and this is what MESH is for Medline. MESH is the Medline indexing term, and that's where the people at MESH have read the full text articles and assigned these mesh terms to the article that describe it. So there is a mesh term for schizophrenia, and so what would happen is the person at Medline would read the paper, and even if the author actually hasn't mentioned the word schizophrenia in the title and the abstract, if in the full text it's apparent that the paper is about people with schizophrenia, then the Medline indexers should tag that record with the mesh term for schizophrenia. So using mesh terms is a really powerful way of finding papers which are about your topic, even though the author might not have used the words that you're searching for in the title and the abstract. When you're searching the PubMed version of Medline, you're automatically looking in the mesh for what your word is. So sometimes you will be searching the mesh as well as the title and abstract. However, if the term you're putting in isn't actually a mesh term, then you won't find it. So I haven't actually got time to go through how you would do a mesh search and a text word search in this session today, but we've linked to some guides for that in the homework. We've got a separate guide that comes along that called Finding and Managing Information for Systematic Reviews. So there's more information there on how you can make sure you're searching the mesh correctly. It is important to make sure we've got that in there. So I'm going to focus today just on how you structure the searches in terms of the words that come in, but bear in mind that we would want these to include some mesh terms and also some free text word searches, which are just looking in the title and the abstract. Okay, and I'll try and explain that a little bit as we go on the other slides as well. Okay, so my final column here on randomized controlled trials. There's lots of different ways that we can talk about randomized controlled trials as well, but actually the Cochrane collaboration have put together a saved search strategy for finding randomized controlled trials that they've tried and tested. So we're going to use that one, and anybody can use that. And again, I've got links to that for you in the handout. I want to go through a couple of quick search tips with you, which will help explain the search that I'm going to show you later. So one is using the truncation symbol, and this is used in lots of different databases, and it helps you find all the different records that have very similar words. The words have the same beginning. So the example here is alcohol. So we have alcohol with a star down on the trunk here, and it's going to find any record which has a word which begins with alcohol. So it would find records which mention alcoholic, alcoholics, alcoholism, alcohol addiction. So all those things might be useful to my search on alcohol, but just be aware that it can also find words that you maybe didn't want. So it's going to find things like alcohols, the chemical alcohol, and if I'm really looking at alcoholism, that's probably not what I want. But it can be, with care, the truncation is a great way of sort of being more efficient at your search. So you're searching, 4 or 5 different terms in one go. It's just a sort of a quicker way of searching. The next tip is, or maybe a refresher for you, is using the OR and combining terms in databases. So when you're looking at a database, you'll often see there are little buttons there where you can combine terms or different search lines using or and. We would definitely want to use the OR combination when we're putting together our search for smoking, because we want the database to find all the records using our smoking terms, and we don't mind if the record has the term smoking or cigarette or tobacco or nicotine. All of them are relevant. They all are kind of pointing to the same thing for us. So we would use OR, and one way to help you remember how OR works is to think that OR is more. So we're getting more and more results when we're combining with the OR, and we're hopefully finding this large set of results which has got smoking, cigarettes or tobacco together. And our next option is to use the AND combination, and we'll be doing this in our search at the very end after we have done 3 separate searches on our sort of individual topics, and then we want to combine those searches in the database and say to the database that we only want the records which have got a smoking term in and a trials term in and a schizophrenia term in, all within the same record. Only those are relevant. I'm not interested in smoking cessation trials which don't mention schizophrenia, and I'm not interested in smoking cessation schizophrenia studies which are not trials. All 3 have to be within the same record. So that's where we use the and it gives us a much smaller set of results. Okay, so I'm going to move on to how we actually start to put the search together, and this is a screenshot of the new PubMed interface, and I've put in at the bottom, my search line 1 is schizo with a star. So I've used the truncation symbol there, so I'm going to find schizophrenia, schizophrenics, schizoaffective disorder. And I've also added some of the psychosis terms as well that we thought of. And you can see here the numbers of how many we've got. So we had 174,000 in the schizophrenia and so on searches. And then once we have put these first 4 together, combine them using OR, that's gone up to 231,000 results in Medline. Okay, so that's our initial search for schizophrenia, our P in our PCOS, and then we just park that search there and start to work on the next search. Okay, I've displayed it slightly differently so you can see the search building up a bit better now. So here from line 6, I've started to add a few of our smoking cessation terms, and there's a lot more we could add here. You know, and some searches become very, very long with lots of different terms. And a lot of it is trial and error, putting some terms in and seeing the kind of results that you get to see if those terms are really working or not. But here I've got smoking cessation. I've put it as a phrase. I've used quote marks because that forces the database to see that as a phrase. In some databases, it might just look for those 2 words separately, not necessarily about smoking cessation. Okay, and then we have stopping smoking and quitting smoking, and I've got the star there to get quit, quitted or quitting, and so on. So here on our line 12 is my combination for smoking cessation studies. So I've combined number 6 or 7 or 8 or 9 or 10 or 11. So I'm saying I don't mind whether it mentions nicotine, gum or smoking cessation. They're all to me about smoking cessation, and I've now got them grouped together in line number 12 as 48,000. Same as down here, number 5, I've got all of my schizophrenia type studies grouped together, and there's 231,000 of those. Okay, so now I park my smoking cessation search and move on to the randomized controlled trial search. It's hard to fit all this on one screen, so I've got the schizophrenia one, the final one on the bottom there, so you can still see that. And this randomized controlled trial search we've got here, this is the Cochrane RCT. There's 2 different versions that they have. This is one of those, and this is available for people just to copy and paste into your Medline database. You'll see here that it's got little brackets with little codes at the side. PT is publication type, TI is title and abstract, and here we've got a mesh term being searched. So this is a more sophisticated search, and ideally when you're doing a systematic review, all of these terms below you'd be searching in specific fields in the title and the abstract or in mesh. I'm just trying to keep it as simple as possible for teaching today, but if you're going to go on and do a full systematic review search, you need to learn how to use the mesh headings and the title and the abstract searching, so you can make sure that you're searching for everything in the right place in the database. Okay, so from 13 to 19, all of these terms have been tested and proven to be quite good at picking up trials in Medline. And so line 20 is all of the trials in Medline, and so there's over 1 million. But some of them are animal studies, are trials in animals. So this is what line 21 and 22 is doing. Line 21 is finding all of the animal studies, and line 22 is taking those animal studies out. So line 22 is all the trials in Medline, but not the animal studies. Okay, oops, sorry, I've gone ahead. So line 23, now this is our final search. So this is where we use the AND combination, and I'm asking the database to find me number 5, which is any record which mentions schizophrenia, and I want records which have a term from there, and I want smoking cessation terms, so they're all kept in 12, and I want a trial term, they're all kept in 22. So these 188 we found in line 23, these all have a term from this trial set, and a term from the smoking cessation set, and a term from the schizophrenia set. You can see we've gone from over 1 million down to 188, which is quite a relief, I would imagine. Okay, so that's a fairly short and simple search, but it gives you an idea of the structure of searching for different PICO elements one after a time, and then combining them together. Just something to be aware of when you're doing searches is that we often see quite tempting limit buttons on the databases, and you can limit your searches to humans rather than put in that taking out the animals that we've just seen. You can limit them to age groups, but unfortunately these don't actually work very well in the databases. They're not 100% accurate. So not every record in the database will have been tagged to say whether it's human or animal. So if we limit it to humans, we are missing all the records that haven't been tagged. Most of them will be actually about humans. And the same with the age groups. That's been shown to miss some records. If you limit it to child, you might miss some records that just haven't been tagged as a child for whatever reason. There are other limits that you can use in databases. One is the year, so you can limit it to certain years, or you could limit your results down to just the English language. These do work quite well, but it's generally not advisable in a systematic review to limit your search results to either the year of publication or the language. You need to have a really good reason that you need to justify why you wouldn't want to search all years for trials. So if you limit it to the year 2000, why wouldn't a trial from 1999 be any good? You know, why is that not as good as a trial from the year 2000? Okay. The randomized controlled trial search that I showed you is one of many different ready-made searches, and you can find more of these on the Intertask Information Specialists website, and there's a link there, and there's another link in the guides which we're sending out to you. And the other thing to mention is you can have a look at other people's systematic review searches and reuse them or adapt them for your own use. Please acknowledge them if you do that. But it's another really efficient way of reusing research which has been done. So these search strategies take a lot of time and effort to put together, and we're encouraged to put them in our journal articles so people can reuse them. So that's absolutely fine to do that, to go and have a look, but acknowledge what you've done, and be aware many of them haven't been sort of formally tested, so you know, have a critical eye when you're looking at them as well. So just to summarise this search strategies section, what we're trying to do is get as sensitive search as possible. We want to find as many relevant studies as possible. So that's why we looked for any trials of schizophrenia that mention smoking cessation. And we know we want a smaller set from that. But if we have that big group, then we can start to screen those down. It is a very iterative process, and in my 15-20 years of doing systematic review searches, I've never once got to the end of a search the first time and looked at my results and thought, okay, that's good, that's fine, I'm going to send that to a reviewer. I've always seen something that's made me think, there's another term I should be using, or oh, I'm getting a lot of irrelevant hits here, maybe I can change some terms. So we always go back and refine our searches a bit to try and you know, add some new terms that we've discovered, or take out some that actually are bringing up completely the wrong kind of information. I spent some time on learning how to use each database, so things like learning how to use index mesh searching, and all the different symbols that you can use for truncation, and searching for specific fields, for looking in the title and the abstract, that can help you develop quite a sophisticated search, so you feel confident you're finding everything that's relevant, but you're not finding a huge amount of irrelevant studies as well. So as I said, I've linked to some online search guides, but talk to your librarians, because they're the ones who are experts in this area, and are generally pretty enthusiastic about doing searching and want to support people in developing their skills. And we peer review all of our searches where we can, and it's one of those things where we all make mistakes all the time with searches. It's so precise. Any slight misspelling makes a difference in the search as to what you're finding, so it's really important to have a fresh pair of eyes, just look through for any mistakes. Okay, I'm going to move on now for the last sort of 5-10 minutes or so to look at things beyond searching. So we only found 188 results in Medline, and that's quite a small systematic review search. We normally find, hundreds in one database, and then when we combine that with other databases, we normally find thousands. So that's a lot of references for you to look at and manage. And within that, there's a lot of duplicates as well. So maybe a third of what we find in Medline, we will also find through the Embase search. Sometimes it's a lot more than that, sometimes it's less than that. So there is a real management task here as well. It's not just about finding the records. And we want to avoid the situation of this poor lady who's become overwhelmed with information, and really hard to have a clear view of what we have. So reference management software I think is essential for when you're doing a systematic review. You can't really manage that information in a Word document on its own, or even in a spreadsheet. It's very hard to manage. So reference management software will help us manage get us all that information together. We can put the records that we've found from all the different databases into one place, and take the duplicates out. So it's very useful for that. But also reference management software, if you're not familiar with this, its key role is actually for when you're writing a document in Word, you can automatically cite those references. So you get a new toolbar at the top, and you have some new buttons that you click on those, and when you're writing, it automatically puts the reference into your document, and formats it correctly. So you can format it for, say, Harvard or Vancouver style or BMJ style, or whichever style that you need to write in. So they're very powerful tools. And we can use them, very effectively in systematic reviews. The other benefit with them is that you're not typing up all those different references and potentially making mistakes, or having that thing where you have to remember the page numbers and the volume and the issue of those references, all those little details which you need at the end of your report, that you found many months ago and maybe have lost. This record in Medline, or whichever database you've got for, should be in a very good format and state. It should be complete, and really all we want to do is move that record, because it's an electronics, the perfect record, move it into your reference management package, take out any duplicates that you find, and then move it into Word or RevMan or whatever package you're using to write your review in. And you never really should have to touch that record. It should remain intact, and you don't have to worry about what the page numbers are, or whether you put the journal in italics or anything like that. You're just moving it through these different packages. The reference managers that I generally use EndNote, because we're fortunate to have a subscription for that here, but I do sometimes use Mendeley, which is a free reference management package, and Zotero is also available. So Mendeley and Zotero are widely used now around the world, free reference management packages. They do very similar functions to EndNote, that you can use them with Word, and you can import from different databases. they don't manage large numbers of references as well as EndNote. EndNote is very powerful when it takes out duplicates across thousands or tens of thousands of records, and importing large numbers of records. But you can still do that in those. It just takes longer and more patience. So that's just a quick heads up on some different packages. There are more packages as well available, but those are the ones that I think are most heavily used. So finally, moving on to search methods reporting. This happens obviously at the very end of the review, but these are the things that we have to put in the review. And I mentioned this last week, we need to have the full name and coverage dates of all of the databases that you've searched. So that's what we'd use the table for. But also we need to have search strategies for every search that you've done. And as you saw from the search which I showed you, we had, I think that was about, I don't know, 20 or 30 lines long. So these search strategies can be quite long and detailed. And if you don't have a copy of those, you're never going to recreate that. So it's really important that you save your search strategies. You can save them within the database. You can often open an account with a database and save your search strategies there so you can rerun them. But it's also really useful just to take a copy of that database search when you run it, and then you've got an accurate record of the date that you run it, and also how many records that you found when you run that search. So if you keep copies of every search strategy that you do when you run it, and if you save them in your database accounts, that's going to be a really good method for keeping track of all of your searches that you've done. I just have one folder that I keep everything to do with my searches in for systematic reviews, so there's just one place to look when I'm writing up. And that will also help you when you're writing up in your methods for obtaining further studies. You can put that detail in that folder. And you should, when you're writing your Prisma diagram and you're giving numbers for how many you've found, all that information then will be in those search strategies that you've kept, the table that you've got, but also in your reference management library. Because you've collated everything together, you should have a final number in that library of references of how many you've found, and then how many, when you took the duplicates out, are left. Okay, so this is just a reminder to save every search strategy. I suppose I'm labouring this a bit because it's a really common problem that I've sort of noticed over the years. It's, you know, if you get to the end of your review and you can't find your search strategy, it's pretty impossible to recreate it as it was. So it is really important to keep hold of that. Okay, I think we've got quite a lot of questions in the chat, and I've also got a quiz, which, so the first question in the quiz is, you found too many records to search. Shall I reduce the numbers by looking at the recent papers from the last 10 years? Okay, again, this is a very common problem. People do a search and you find far more than you're expecting. Is limiting the date to just looking at the last 10 years, is that something that you should do? Great. So most people have said no, we shouldn't reduce to the last 10 years, but there are some yeses and there's some not sures. So it's all about justifying if there's a good reason for you to limit your search to the last 10 years. Very often that there isn't really a good reason why only the last 10 years of trials are relevant for your question. Occasionally there is, so it might be if it's a systematic review which is very closely related to a particular policy, and if that policy came into force 10 years ago, then or maybe 5 years ago, then it may be that you can justify that there's no point looking at the literature before that, or it might be a sort of more of an epidemiology review, and the earlier epidemiology really isn't relevant. So sometimes it can be useful, but very often it isn't. So you just have to be very careful if you can justify that or not. Okay, can we go to the next question, please, Nikki? Okay, so this is a question about those buttons we have on the database screens. So if I was doing a search and I searched for mint or chocolate, I could do that, or I could search for mint and chocolate. Now, which search is going to find more records? Yes, the answer is mint or chocolate. We're going to find more with mint or chocolate. So if we search for mint or chocolate, then we're going to find things about the plant mint on its own. We're going to find things about mint sauce, for example, and we're also going to find things about chocolates and cherry chocolates and chocolate bars. Whereas if we searched for mint and chocolate, both the mint word and the chocolate word have to appear within the same record. So we would find things like chocolate bars with mint in them, you know, mint flavoured chocolate, that sort of thing. So we'd find a much smaller set of results there. We wouldn't find things about cherry flavoured chocolates or strawberry flavoured chocolates. We'd only be finding things about mint flavoured chocolates. But can I use exactly the same search strategy in each database? Great, thank you. So yeah, people, you know, not sure. Half of people saying no, and a third of people saying yes. So what we try to do is develop a really good search strategy in one database, for example, Medline, and look at the results and make sure we think that's working really well, and then translate that to other databases. So we try and keep it very similar. But it can't actually be exactly the same, and the reason for that is the indexing terms are different in pretty much every different database that we're searching. So MESH are the indexing terms for Medline. In Embase, they have a different thesaurus of terms called Mtree, and they are, some of them are the same, similar to MESH, some of them are a little bit different. So if we copied and pasted our Medline search into Embase, it wouldn't work as well as if we properly searched for those Mtree terms. It would guess what we would mean. So what we need to do for each database is relook at the indexing terms that we've used and see what's applicable in that particular database. PsycInfo has a different set of indexing terms again. So sometimes, I might have found a MESH term for smoking cessation, for example, in Medline that seems to work well. And when I look in PsycInfo, maybe there isn't an indexing term for smoking cessation, but there might be an indexing term for e-cigarettes. So you have to look in each database at the indexing terms to make sure that you've got the most appropriate ones for that database. The terms that you're looking at in the title and the abstract, they should be the same in each database that you look at. The only difference I would actually say is when you come to search some of the websites for things like clinical trials, for those sort of databases, it's very difficult to put in long search strings or lots and lots of different searches. So you have to really adapt your search a lot and maybe only have one or two broad terms for smoking and one or two broad terms for schizophrenia or psychosis, rather than having a big long list. So yeah, the answer is no, we don't use exactly the same search strategy, but we try and keep it as close as possible.
Where you'd find the indexing terms?
So in PubMed, at the top of the screen, you can move out of PubMed and go into the MESH database. So there's a separate MESH database that you can look at, and then you find a MESH term there, and then there's a link in that on the screen to push that MESH term into your PubMed search. So you sort of go off into a separate MESH database, find the term, and then say, add to my PubMed search, and then it appears in your search. But I would advise going through the PubMed online training and videos on how you do MESH searching, just to remind you on that. If you're using Ovid Medline, there's a little box that you tick when you're doing when you put a search term in, you put in the search term schizophrenia, you can tick a box which says map to subject heading, and then it will then take you to a new screen. It will suggest subject headings that it thinks you're interested in, and you can then have a look and choose which one you would like. So there's a separate website called Mesh Browser where you can browse different mesh headings as well. So there's a few different places where you can find them.
Okay.
Actually, and another tip actually for finding mesh headings is if you're struggling to find them and you have one or two really good trials that are very much on topic that you know are relevant. If you find those in Medline and then look at the full record from them, and they should list all the mesh headings that have been used for that particular trial. That's another way of identifying, you know, how and working out how Medline is indexing these trials. So if you see the mesh headings that are used on a trial that you know is relevant, then you can get an idea of which mesh headings might be useful to search.
Okay. I'm aware of the time, Judy, so
Yeah.
perhaps we need to move on to homework.
Yes, absolutely. So the homework is a search strategy which we've put together, which has got some mistakes in. So it's similar to the one that we've been looking at today, and we just want you to have a look at that search strategy and spot the deliberate mistakes, let's say, and then when we come back in a couple of weeks' time, I'll go through the search strategy and show that, and it'll just be it's a good way for you to have a look at search strategies and start to read them and be able to sort of appraise them as you would with other parts of a review.
There are a couple of questions that Nurture's been fielding around mesh terms and branches, so I think I'll skip that. Another one is, do you have to specify the differences or the adaptations that you've made to each search strategy for each database in your report or your publication?
No, you don't. You don't have to, and I don't think I've seen anybody do that. The only things that I've seen, people have described why they've searched in a particular way sometimes. So it may be that when you're developing a search, you might think there's some really obvious search terms to use, and then when you start to do that, it doesn't work very well. You're picking up a lot of irrelevant items. So you change your search, but you might want to just put a bit of explanation about that in the method, so anybody else who's reading that understands why your search looks the way it does. And I suppose one example is we've done a review on child restraint, so restraining children, interventions to try and stop having to restrain children in mental health wards or in police cells and various things like that. And when we were doing the search for different child restraints, we came across a lot of work on seatbelts, on car seatbelts and car restraints. So we had to put an extra bit in the search that just took out all of the trials about car seatbelts, because they were just so completely out of what we were looking in, and so we wrote a little bit of narrative about why we'd done that in the search and not kept it really comprehensive because it was safe to do. And the other thing is, if you're updating a search, so when you come to the end of a review and you might need to rerun your searches to get the latest trials, sometimes you don't have access to the same databases, or you might find there's a new mesh heading that's appeared. Then your search will change a little bit, and you need to write about that. So you need to explain if within the review your search has changed from the original search to the final search, if there's been a bit of a change at that point. But to go back to the question, you don't have to say how it's changed slightly between every little database as you translate them.
Okay, thank you very much, Judy. I'm going to go on just to the final part of this, which is to recap what we normally do. After this session, we're going to upload the slides as we usually do to the Google Drive, but we have also been converting the recordings to a YouTube video, so that should be available shortly too. We're also going to add the homework that Judy's just explained. We're going to put that on the Google Drive as well. And again, we're going to start the next session with a discussion of that homework. Really important, we're going to send you an evaluation form. We do that every time as well. Please do complete it. It really helps us, because you might have seen that we do actually modify what our plans are according to the feedback. So really appreciate if you can take a little bit of time to fill that form in. And we'll share the Zoom details and the schedule for the next session as well with you. So thank you very much to everybody for taking part, and we'll see you next time.